isn't it a tragedy that the government says they have employed 50,000 nurses since they came, and still nurses are picketing, and demonstrating? I mean, it just shows that it's not true. Recently, we have been told by the Nurses and Midwives Council, or whichever body it is, that the total number of nurses in Ghana does not exceed 70,000. So how could you have employed 50,000 nurses? And so that's a fallacy. What we did was to expand access to healthcare by building new hospitals. You cannot employ nurses when you don't have anywhere to post them. And that's why we started all the district hospitals. And our policy, when we launch our manifesto, is that there will be a modern health facility in every district of this country, depending on the population size of the district. It can be a health center, it can be a polyclinic, it can be a district hospital. And then I already announced that in the 6 new regions, we're going to put 6 new regional hospitals. We're also going to open the University of Ghana Medical Center and operationalize it so that we can employ. All these will lead to the employment of more nurses and doctors. We're going to start phase 2 of the Rich Hospital project so that we can have more beds. We want to end the no-bed syndrome. We shouldn't have an emergency where you go to any hospital and they say, we don't have beds, take the patient away. Or even if they are forced to admit them, then they go bring plastic chairs and put the patient in with a drip by their side. It is not the Ghana of the 21st century. And so we're going to expand the healthcare sector so that we can bring in more nurses and paramedicals. We'll fully operationalize the WA Regional Hospital. I mean, it can take how many nurses? The program that we had before we left office, we're introducing 6,000 new hospital beds. And if every hospital bed requires 3 paramedicals, that's 6,000 times 3. You can imagine how many people we could have employed. And so those are some of the things we'll do in order that we can employ more of our health sector staff.